Can I start by saying that as the State Coordinator, I've challenged the Control Agency, SA Health, on the need for these significant impositions that we're about to place on the community for a relatively short period, and I am 100% supportive of the approach that's being taken. The changes that are occurring now as a circuit breaker are quite comprehensive and will have an impact on virtually every member of the community. What I'll do is I'll just explain some of the areas that we are going to be closing or shutting down for a 6-day period, and after that 6-day period there'll be a further 8 days of other restrictions which will be not be as significant as the ones I'm about to outline. This is not yet a complete list. South Australia Police, along with SA Health, are working to consolidate this list. This will give a very good indication of the extent of the changes that we're making, but we will be providing further information during the course of the afternoon, which will give everybody sufficient clarity to understand exactly what changes we're making. Things that are being closed or shut down effective midnight tonight are all schools except for children of essential workers and vulnerable children. Takeaway food will be shut. Universities will be closed. Pubs, cafes, coffee shops and food courts will be closed. Elective surgery, except for urgent operations and cancer treatment, will be closed. We are closing open inspections and auctions for real estate. We're also closing all outdoor sport or physical activity. FIFO workers will be on standstill for 6 days. Regional travel is not approved. If you are in a location at the commencement of these restrictions, you'll be required to stay there. Aged care and disability residential care will be in lockdown. Factories other than food and medical products will be closed, except for where it is necessary for them to remain open to prevent damage to machinery. The construction industry will be closed for 6 days. Holiday homes will not be available for lease or rental. Weddings and funerals will be banned for 6 days. Outdoor sport is not permitted. Masks will be required in all areas outside the home. Some of the areas that will remain open, which will be considered as essential: critical infrastructure, including water, power and telecommunications, will be able to function. Supermarkets will remain open to provide access to food and essential products. There will be limitations in terms of access, providing specific access to vulnerable members of our community to ensure they can access goods and services. Medical, including mental health, supplies, access to services will be available. Public transport will be open. The airport and freight services, including courier services, will be able to operate. Petrol stations, access to financial institutions and post offices will be able to be accessed. Mining, smelting and large factories will also be able to remain open, but only those parts of the facilities that need to operate to ensure continuity of service delivery or to prevent damage to the plant. Childcare will be available only for families of essential workers, and the minimum operations of government, including local government, will be permitted to operate. Veterinary surgeons will be able to remain open. People will be restricted from going out of their house for a 6-day period. The message is stay at home unless you are accessing essential services or you are an essential worker. Exercise will not be permitted outside of the home for a 6-day period. Food purchases will be available. You will be able to leave one person per household once a day to access groceries. Agriculture will be able to move about to ensure the safety and welfare and processing of animals and the production of dairy and other agricultural services. End-of-life visits will also be available through organised arrangements. That's the list as it stands at this point, but I stress we are still working on the final list in terms of what those restrictions will be and what will be allowed to operate, and we will be updating further into the afternoon and evening as that list becomes available.
Did you ever think we'd get to this point?
I have to be honest with you. I suppose there was a time during March, April when I thought that the advice we were receiving from health, the trends we were seeing overseas, certainly led us to consider these types of restrictions. But with the way we've been able to manage COVID-19 over the last few months, I must admit this is something that we didn't anticipate. It's something that we've got contingencies in place for, but I think it's important that we take these steps to ensure that we can support SA Health as much as possible to eradicate this virus.